All right, we're live. Hey guys, it's Carissa. I'm here with Kirsten and Nick. We're doing a presentation on everything UCL of the elbow. So all injuries. We're going to talk about a few things. Kirsten, you want to tell them what we're talking about?
All right, so we've gone through 3 different studies on injuries to the UCL of the elbow to try our best to figure out which intervention is most applicable to our setting and which is most effective in treating the conditions.
Yeah, so I hope you guys enjoy. Kind of bear with us on the technical side of it. None of us are techies, so we're handling through it. So I hope you enjoy. And
All right. So UCL injuries to the elbow. All right, first, our diagnostics test that we went over was the moving valgus stress test. Our PICO question was, is the moving valgus stress test a valid test for determining a positive tear in the UCL of an elbow and overhead during athletes? Here's our video of what the test is. Okay, so what she's going to do here is she's going to take his elbow and she's going to put him into abduction, and she's also going to bend the elbow into flexion. So that's complete flexion. What she'll do is she'll apply with her left hand, she'll apply a valgus load and bring his forearm with her right hand into extension. It's kind of like it mimics the what do you call it? Mimics the throwing motion. So a positive sign would be if he screams out in pain. You might also be able to feel a little bit laxity with that as well. Okay, so our synopsis of our study. In this study, we had 26 patients, 13 of them baseball, 2 tennis, 2 golfers, 1 gymnast, 1 football, 1 arm wrestler, and a non-athlete, just in recreational stuff. I believe it was 2 of the patients were also female. In this study, the play level ranged from recreational all the way to professional athlete. All the patients in the study had been referred to the author if their UCL was suspected. All the patients also were tested with the gold standard, that being an MRI, to confirm the diagnosis. No control group was created. They were just compared against the validity of an MRI result. So our specificity and sensitivity came out to be that the specificity was 75%, and then the sensitivity was 100%. So the negative predictive value was equal to 100%. The value was equal to 94.44%.
All right, our second study, take a look at the PRP injection as a intervention for UCL tears. Our PICO question here reads, how valid is a platelet-enriched plasma treatment in returning an overhead athlete back to play versus a non-surgical study done by Rettig and his fellow researchers. There's a video we've got for this one as well. So what he's going to do here is mark injection sites there on the patient, make sure we've got it exactly where we need it to be. It's a simple injection procedure. Inject platelet-rich plasma back into the bloodstream at the UCL site. This one here is for tennis elbow, but we figure it's the same treatment done on a different structure that would yield the same results as the UCL site. Our population here for this study included 34 overhand throwing athletes with partial UCL tears. Those tears are confirmed by MRIs, which is our gold standard from the previous study. Our patients had symptomatic grade 1 and grade 2 partial UCL tears, as grade 3 was excluded from the study. All the athletes failed a conservative therapeutic exercise session that included 6 weeks of supervised physical therapy for their UCL conditions. All of our patients also failed a progressive return to throwing program. Our patient population here was not randomized in this study. However, patient underwent the PRP injection and completed 12 to 14 weeks of supervised rehab with a certified clinician. There was no blinding in this study either, as each subject received the same injection completed by the same physician, and all completed the same rehab program for 12 weeks to provide the continuity of the same clinicians working with the same patients. Both the physician and the physical therapist knew exactly which treatment was being received by which subject. Subjects completed the DASH score as a baseline. The DASH is a checklist over the arm, the shoulder, and hand that contains activities of daily living. The subject answers a task with how difficult it is to complete those tasks and how painful it is to complete them. Each response is assigned a score, and the total number is added up at the end of the test. Subjects also completed KJOC at baseline. This is an athlete-specific questionnaire. Responses are assigned a score in this one as well. The questions in this one include what is the highest level of competition competed in, how difficult is it to warm up with your condition, how unstable does your elbow feel. Additional baseline measures included an ultrasound that was measured in millimeters and medial joint space at the elbow. All subjects were fairly similar at the time of baseline completion. And this is important for validity of the study. The results here, 30 of the 34 patients that participated were able to return to play with no complications. According to our calculations, 88% of those you who are like Carissa as well as like myself are not any mathematicians whatsoever. On average, each patient had returned to play in 12 weeks. All of our subjects showed significant improvements in their DASH and their KJOC scores. We showed significant improvement in the measured joint space following treatment. So our relative risk here is compared against non-operative treatment specified by the return to play rate described by Rettig in his study at 42%. 88% of our athletes returned to play via the PRP injection. A relative risk counts to be 0.21. Absolute risk reduction results are also there for you. Relative risk reduction came out at 79%. Alpha number needed to treat is 1 over the absolute risk reduction in calculation. A little bit over 2 patients needed to treat. So about every 3rd patient that we see with these PRP injections has a positive outcome. Of the original subjects, one was excluded due to the ipsilateral shoulder pain that they were experiencing. The KJOC score does not account for pain anywhere other than the structure being tested, and therefore the subject was excluded from the results. 4 patients could not get a clear measurement of the joint space when receiving ultrasound and were therefore excluded as well. The exclusion rate was held here at 15%.
All right, guys, so I got our final modality. In all of our searching for some of our UCL injuries, we didn't find a whole lot of modality use that was kind of outside the norm. There's a couple of ultrasound ones that didn't provide a whole lot of strong evidence. So we ended up finding a modality used for low-level laser therapy on a lateral epicondylitis in the elbow. So we decided to pull this modality use into the UCL so we could not extrapolate directly to the actual ligament of the UCL, but we can make some kind of references here and see if any kind of evidence does start pushing that way in supporting low-level laser therapy. So our PICO question was, effects does a low-level laser therapy have on a mechanical pain threshold, maximum grip strength, visual analog scale, and that DASH score in patients with the lateral epicondylitis. So we do have some videos kind of showing some laser therapy. So lasers. I don't know if I want that kind of therapy. It looks a little intense. So let's try this one. So you can see the device is run over several points of the elbow, and the laser is able to penetrate and provide the heat directly to the skin, probably more effectively than this treatment here. So that's what the normal laser therapy looks like. So we'll move on to the actual study. We did have a population of 39 patients. They were of all genders and age ranges. They were 39 patients who had presented to a specific clinic, all having the same symptoms. So to be included in this study, they had to have pain with palpation at the lateral epicondyle. They had to have pain when doing resisted extension of the wrist, and then pain when doing passive stretching of the extensors as well. The 39 patients were randomly assigned. They had an investigator who basically drew names out of a hat. That's what kind of draw lots means. He just randomly picked a name to go to one treatment group or the other. Patients were all given the same exercise program to be completed in between their laser treatments, so that they were all doing the same thing, whether the placebo group or the actual treatment group. Those who did receive the placebo, they went through the same procedures as those receiving the low laser light therapy. The only difference was that when the investigator, the tester, was performing the therapy, they did not switch on the actual laser itself. All patients did receive 3 sessions a week for 3 weeks' time, and all were tested during the same time interval during their rehab program. The patients were blinded. They had no idea whether they're in the treatment group or in the control group, but the clinicians, those performing the test, were not blinded. They knew which test was which. The results that we received, we were testing, if you guys remember from the PICO, we're testing for the mechanical pain threshold, we're testing for their grip strength, we're also testing for the visual analog and their DASH scores. So for mechanical pain threshold, The group that received the laser treatment actually received a mean of 3.8 on the mechanical pain threshold, which was an increase actually from their baseline. They had a standard deviation of 1.26. We can compare it to the placebo group, which had a mean of 1.87 with a standard deviation of 0.91, which actually was not, in turn, not a huge increase. That when we compare the two means, that actually does give us a confidence interval of 2.65 to 1.21, with a mean sitting at 1.93, giving us that the laser therapy was in fact significant in helping increase the mechanical pain threshold of the patients. The confidence interval tells us that we can actually extrapolate this to the general population. So 90% confident, with confidence we can say 95% rate would, the population would sit in between that 1.21 and that 2.65 increase for mechanical pain threshold. Move on to the maximum grip strength. Laser group, a 29.57. Again, that did increase off of their baseline with a standard deviation of 8.96. The placebo group, 21.61 against a standard deviation of 9.70. This also did increase slightly from their baseline. So once again, that confidence interval lets us sit between 1.90 and 14.02 with a mean sitting right around 8. Again, not crossing over the 0 line, so a significant difference in favor of the laser treatment. Our last two, the visual analog scale, the DASH score. Laser group dropped their visual analog scale to 1.48 with a standard deviation of 1.36. This is good because a positive benefit for both the visual analog and a DASH score are lower symptom scores. So the lower score we can get, the more positive of an outcome that actually is. So going against the placebo group, you can see the numbers there. That gives us a confidence interval of 1.66 to 3.94. Once again, leaning towards the laser therapy had a positive benefit in the laser group versus the placebo group. The numbers on the DASH score, you guys can kind of read them there. This is a really big difference. This is probably the largest difference that we did see. The largest drop was in the DASH score with means. So you can see our confidence interval there, a 6.11 to 25.47. It's a pretty wide range of a confidence interval, but it does favor the laser group once again. You can kind of see that theme trending, that the laser group provided more positive results. So we'll just kind of wrap up here just a little bit, just a reminder of kind of what we've discussed. So the moving valgus stress test, with its specificity and sensitivity, did prove to be a very valid and effective test for diagnosing a UCL tear in overhead athletes. Platelet-enriched plasma did show positive effects for returning an athlete to play when compared to doing just a conservative approach. And then the low-level laser therapy was a beneficial treatment for lowering pain symptoms, increasing grip strength, and pain threshold in a general population.
All right, so PADRA and CEBM scores. For our PADRA score, for our moving valgus stress test, we found that it satisfies 6 of the 11 criteria. Same thing with the PRP injection. The reason because of this is because it does not satisfy criterion 2, 3, 5, 6, and 7. Most of those have to do with blinding, which those studies do not have. The low-level laser therapy satisfied 9 of the 11 criteria. Again, this one didn't satisfy a couple of the blinding criteria. For the CEBM, we're figuring that the moving valgus stress test and the PRP injections are equal to a level 3A, whereas the laser therapy is equal to a 1B.
All right. So the information that we've found and that we've presented to you guys is a little bit mixed, but most of the time it's going to be. One hand, we've got the moving vagus stretch test and the PRP injections that show really positive results in diagnosing and treating overhead throwing athletes who are suffering from UCL complications or injuries in the elbow. However, low-level laser therapy as a modality, after our short amount of research, we've determined kind of can't be extrapolated very effectively to the athletic population. There's not enough evidence is there and available currently to apply the effects of the therapy to overhead athletes that we're trying to keep healthy and in play. There's more research that is warranted, definitely needed to validate low-level laser therapy as a treatment on competitive athletes before any conclusions can be drawn regarding its effectiveness. The research, however, does present well and shows promise being valid modality in the future for UCL injuries.
All right, guys. Well, we hope you enjoyed our lecture there. Hope we were able to present some research that maybe some people haven't really looked into before. We like to looking at a couple of modalities and treatments that usually aren't seen, and that's why we wanted to pursue those and see what kind of validity they do have, such as like a PRP injection or low-level light laser therapy. So just some different things than what we would traditionally see, and see what if we could find some valid results or what the research was telling us through those PICO worksheets. So definitely hope you enjoyed the lecture. Hope you learned something, and once again, have a happy Thanksgiving and a Merry Christmas. See you guys.
Yeah.
Holidays, everyone.